Hi, my name is Kelly Kanaka and I'm here to talk to you about OCD. OCD is characterized by unreasonable thoughts and fears that lead you to do repetitive behaviors. Obsessions are involuntary, seemingly uncontrollable thoughts, images, or impulses that occur over and over again in your mind. You don't want to have these ideas, but you can't stop them, and unfortunately these obsessive thoughts are often disturbing and distracting. Compulsions are behaviors or rituals that you feel driven to act out again and again. Usually compulsions are performed in an attempt to make obsessions go away. However, the relief never lasts. To be diagnosed with OCD, your obsessions must meet these criteria: reoccurrent, persistent, and unwelcoming thoughts, impulses, or images that are intrusive and cause distress. You try to ignore these thoughts, images, or impulses, or try to suppress them with compulsive behaviors. Compulsions must meet these criteria: repetitive behavior that you feel driven to perform, such as hand washing, or repetitive mental acts such as counting silently. You try to neutralize obsessions with another thought or actions. The cause of OCD isn't fully understood. The main theories include biology. OCD may be a result of the changes in your body's own natural chemistry or brain functions. OCD may also have a genetic component, but specific genes have yet to be identified. Some environmental factors, such as infections, are suggested as a trigger for OCD, but more research is needed to be sure. The two main treatments for OCD are psychotherapy and medication. Often, treatment is most effective with a combination of these. Exposure and response prevention involves repeated exposure to the source of your obsession until the person is desensitized. Cognitive therapy focuses on the catastrophic thoughts and the exaggerated sense of responsibility you feel. It teaches greater awareness and acceptance of symptoms and tries to teach the person how to relax. Certain medications can help control the obsessions and compulsions of OCD. Most common are antidepressants. Success of treatment depends on the severity of the case. Some people may not be able to cure their OCD, but they can treat their symptoms so they are more mild. There is a difference between being a perfectionist and having OCD. OCD thoughts aren't simply excessive worries about real problems in your life. Perhaps you keep the floors in your house so clean that you could eat off them, or you like your closet arranged just so. That doesn't necessarily mean that you have OCD.
Elizabeth McInvale has lost control of her life. The 20-year-old University of Houston student scrubs her hands sometimes up to 100 times a day.
Clean underneath all my fingernails every time.
You can see how raw and discolored her hands are. Her fear of contamination results in many other exhausting daily rituals that she just can't help. Elizabeth suffers from obsessive compulsive disorder, or OCD.
Ritual after ritual, day after day, and OCD becomes a living nightmare.
Elizabeth can't even make it through part of her day without these neurotic, obsessive actions to avoid germs.
I have to open the door with my foot.
See how she won't even touch the light switch with her hands? And when she tries to get dressed, many of her clothes are off limits.
All the stuff that's contaminated in here, like these pants are contaminated from vacation.
Her life, like millions of others with OCD, is so tough that she sometimes takes out her aggressions on her walls.
I get so frustrated that I kick and punch holes.
No one knows Elizabeth's frustration more than her sister, who also lives with her.
It's so sad to see my sister tell me multiple times a month that she wishes she was dead. I mean, you can't do anything about it.
And Elizabeth isn't alone in this nightmare.
There are probably between 4 and 8 million people in the United States alone that have obsessive compulsive disorder.
Among them, actor Leonardo DiCaprio says he was sometimes obsessive compulsive as a child. Fittingly, DiCaprio played another high-profile OCD sufferer, Howard Hughes, in the film The Aviator. And notice on Deal or No Deal, Howie Mandel won't shake hands with contestants because of his reported OCD.
I don't shake hands. What I do is I do this because I'm a little bit of a germaphobe.
And recently, international soccer star David Beckham revealed he has some form of the disorder. While there is no cure for Elizabeth and others suffering from OCD, behavior modification treatment has proven a step in the right direction. And that's why Elizabeth is now the national spokesperson for OCD awareness.
My name's Elizabeth, and I have obsessive compulsive disorder. There are 500,000 teenagers in America just like me.
And for Elizabeth McIngvale, getting help for those in her shoes is the best therapy of all.
There's people out there that struggle more than I do, and my heart goes out to them.